Hello, I'm Dr. Jayendra Yadav. I'm a consultant neurologist at Fortis Vashi. So our face muscles are supplied by a nerve called facial nerve. It's a seventh cranial nerve. It is responsible for supplying the muscles which are concerned with our eye closure, eye opening. Muscles are our cheeks and lips, upper lip, lower lip. So this facial nerve can get damaged because of various reasons. Sometimes it can get damaged because of the traumatic injury, or it can get damaged because of some ear infections or some viral infection which particularly damage your facial nerve. Or sometimes it can also get damaged because of the some tumors which brain tumors which kind of compress this facial nerve inside our skull. So among all these, the most common reason for facial paralysis is a viral infection affecting the nerves and causing this damage. So that condition is called as a Bell's palsy. It's the most common reason of facial paralysis. So these patients usually present with symptoms like difficulty in eye closure, difficulty in blowing cheeks, facial drooping. So while speaking, they'll notice their face is getting deviated to other side of the face. Usually these symptoms evolve over 1 or 2 days. Unlike stroke, when somebody notices a facial paralysis, it is sudden onset. But in cases of facial paralysis, the symptoms evolve over few hours or 1 or 2 days, and then it becomes very apparent. It is not as dramatic weakness as you see in stroke. So sometimes patients can also experience some pain behind their ears, and few patients can also experience change in their chest. So if somebody notices some symptoms related facial paralysis, they should visit a neurologist at the earliest. First of all, to differentiate what type of facial paralysis weakness it is, whether it's a stroke or because of some viral infection called as I said, Bell's palsy. Bell's palsy is treatable if it is treated at the earliest. As I said, Bell's palsy is because of the viral infection. So we can start some antiviral drugs to prevent further progression of facial nerve damage. When virus attack these nerves, there will be swelling of the nerve. So we give some short course of steroids. These steroids are useful if they are started during the early course of the facial nerve damage because of the viruses. So if we start these steroids and antiviral at the earliest in case of facial paralysis, in case of Bell's palsy, patients recover very well. Along with this, we also give some facial exercises to help patients recover through the facial muscle weakness. So patients should take certain precaution, like they should avoid cold exposure, and while sleeping at night, because eye remains open. If the eye closure weakness is prominent, they should use some eye closure eye padding, so that their cornea or the conjunctiva doesn't get exposed to the cold air, and that predisposes to infection. So Bell's palsy is treatable if it is detected at the earliest, and we start antiviral and the steroid therapy at the earliest, along with the facial exercises, physiotherapy. We can give physical therapy, and sometimes nerve stimulation can also help in these patients.